Hi, everybody. I am really pleased today to have back again a friend of mine and someone who I highly respect, Gerda Maissel, who is an medical advisor and medical Sherpa and certified patient advocate. And so I'm just going to ask Gerda, welcome, and just tell us a little bit about yourself, and then we'll dive in.
Hi, Cheryl. Thanks so much. So, I'm Dr. Gerda Maissel, and I founded a business called My MD Advisor, and I do medical navigation and private patient advocacy, which means that what I do is when people have complicated medical issues and they need essentially a friend, like a doctor in the family, I help them get through the healthcare system. It might mean that a person's in the hospital and they want someone to help connect all the dots. It might mean somebody who's in the community who's struggling with care decisions, or somebody in the community who has 10 different doctors, none of whom talk to each other. Or maybe they're on 20 different drugs. Whatever the issue is, I help them not as their doctor, but I help them get better medical care.
Right. And I am so impressed with your newsletters and all that you've been doing lately. And I even have had a couple of my own clients who are caregivers, care partners, and they are my particular audience. So when I'm able to help them sometimes stay calm and gain clarity, and then they'll say to me, all right, I'm calm now, but I am not clear. And this is where you can really come in when people are in a medical crisis with their loved ones. Um, Tell us a little bit about, well, I've been fascinated with the newsletter that you send out called Fog Light, and and you've been talking recently about the broken system of the medical care and how people are people in a bed, not a chart hanging on the end of a bed, and that you can come in and actually you, on behalf of your client and on behalf of the family and the patient, you're, as a doctor, you're able to actually connect with their doctor and make some progress and get clarity, right? Could you say more about that, or maybe an example of, you've given great examples in your newsletter, and I have examples, but maybe you would mention one success story that might come to mind.
Well, gosh, so the topic is helping people have better communication with their physicians when they're in the hospital. So what happens in the hospital with the current system is that you have hospitalists, doctors that are assigned to you full time. They're assigned to you as your doctor. You don't have your primary care doctor come into the hospital to see you anymore. There's lots of reasons for that, but we won't go into that today. And so it used to be that hospitalist was with you for, say, a stretch of a week. So if you were lucky enough to come in on a Tuesday when they started, you'd have that same doctor the whole time that you were there. But now you might only have that doctor, even if you came in on a Tuesday when they started, they might be there Tuesday and Wednesday, and then there'd be a different doctor Thursday and Friday, and a different doctor on the weekend. And so what happens is those doctors have big caseloads, and they're really working off of sign outs or checklists rather, like, oh, check the following labs and then discharge. And so they don't have a chance while they're running around between patients to think deeply about any individual human being. And each of us are different. Each of us have our own past medical history, and we have our own context of who we are as a human being, what we believe in, what we're afraid of, what our families are like, what our dynamics are like, how we approach health, how we approach illness. And so, unfortunately, much of that subtlety gets lost when you have the doc of the day. I mean, it might be the doc of 2 or 3 days, but when you have a doc of just a couple of days who really doesn't know you, who is purely viewing you through the lens of your labs. And I'm trying to think of a good, quick example for you, but many times I have found myself in the hospital essentially as the historian, connecting one patient or connecting the doctor to what's been tried before. Oh, I've got an example for you. I
Well,
had
I'm sorry.
So I sort of thinking as we're talking. So I had a gentleman who was in the hospital who had a difficult problem with his lung. And they had to go in and try to do a procedure to reinflate his lung. And they tried it once and it didn't work. And and this is now a specialist, not a hospitalist, but that specialist came back in and he said, well, I think it's worth trying again. So now, as I'm following a client, I talk to the doctor. I'm there, the client will call me and I'll get on the phone with the doctor. And I asked, well, what happens if this repeat procedure doesn't work? And, this superstar subspecialist said, well, there's this other thing we could do. We don't typically do it, but if it doesn't work the second time, I think it's worth, if you still want to keep going, I think it's worth this other procedure. And so, okay, we sort of tucked that away. He did the original procedure the second time, and it didn't work. The fluid came back, the lung did not properly reinflate. That specialist, that superstar, rotated off service. New specialists come in and they look at my patient, who was a little old guy in a bed, and they're like, oh, sorry, this is it. There's nothing else we can do. We've tried procedure 1 twice and we're done. And you're basically just going to have to live with a chest tube, and this is who you are for the rest of your life. And I said, well, hey, Dr. X from last week said that if it failed, he would try this second procedure. And they went, oh. And then they went back, and later in the afternoon, they came in and they said, we looked into it and we can offer you that second procedure. And the patient absolutely wanted to continue on. He did not want to live with a chest tube. They did the second procedure, or the other procedure, and it worked. And so that's just a small example of, if I hadn't been able to ask the question, well, what if this fails? And bring the historical piece of information that probably wasn't written down, that there was this other option, this poor man would have had a chest tube until he passed away. But in the end, he didn't. The alternative procedure worked, and he was very comfortable and very happy.
That is a success story. And I guess the point here that I'm trying to make to people who are caring for others when they're in crisis is that most of us have no access to have that kind of a conversation with these doctors like you do. So you are, in fact, and I don't think you're using this term anymore, but the medical Sherpa, guiding us to a solution. That's great.
Yeah, the medical Sherpa term. So because it rhymes with Gerda, I was Dr. Gerda, the medical Sherpa, for a little while. But it turns out, and I didn't realize this, that Sherpas it's an ethnic name. And so you don't want to take on somebody's name. So I've dropped Sherpa. But it is descriptive when you think about somebody helping carry the load on a trip.
Yeah, so you are the medical guide as a so we'll just go with that.
Right.
Well, I just wanted to, what could we, how do you work, Gerda? What can people do if they decide, yes, that I'm going to tuck this away, I might need this, or I might need Dr. Gerda right now? What should they do?
Well, the easiest thing is to reach out to me either on my website, which is mymdadvisor.com, where there's a way you can sign up for an appointment, or just email me. And my email is GM, for my initials, gm@mymdadvisor.com. That's the best thing. I answer my own phone. So sometimes when people call me, I'm in the middle of something, and I always want to be able to give someone attention when they call. So it's a little bit better if they, reach out and we find a time where we can both give each other full attention and I can listen to what's going on. And, sometimes I'm not the right person. I get calls, where they're looking. So for example, I've had people calling me with billing issues. Well, I'm not a billing advocate. I mean, I can do clinical appeals, but if you've got a problem, because they overbilled you for something and you need someone to help you with that, I'm going to refer you to the right person. So, and I'm happy to do that for people. Listen, the healthcare system is so difficult. I'm happy to just, navigate people and send them to the right person if it's not me. My focus is going to be helping people with the medical issues.
Absolutely. We sure do need it. And, this job that you're doing is really helping people, I would imagine, and people don't have to be in crisis, but I'll bet mostly they are. Um,
They often are, and that's fine. I make myself available evenings and weekends and holidays, and I pace my work out so that I'm not going insane. But, I had a lady once call me at 1 o'clock in the morning, and my husband gave me the hairy eyeball, but I answered the phone, and she was in the and this was a client that I'd been helping with a foot. She'd been having this weird foot pain. And she had then gone to the emergency room, and it turns out that she had an obstruction in her artery in her foot from a little clot. And that was the cause of the pain. And there was the surgeon in the room with her trying to talk to her about the options. And so she called me. And not that I want people to call me at 1 in the morning, but I'm really glad that excuse me 1 second. I'm really glad that she did call me, because as the surgeon got on the phone, the surgeon started saying, well, I don't know if we really want to go to the OR in the middle of the night. We could try blood thinners. Da, da, da. And I said, well, if we did surgery, and I feel like now this is the second story about talking someone into an intervention, but I just talked to the doctor. I said, well, what would surgery look like? What are the pros? What are the cons? And by asking doctor questions, I literally was helping that physician talk through an interesting case. And she was very engaged with me, and she talked it through. And she came up with a couple of options beyond what she'd originally presented to my client. The client did decide, because she'd been suffering for like a week with this horrible pain, that she wanted surgery. She went to surgery, clot came out, foot much better, saved, all good. I'm really glad that I picked up that phone and was able to help both the doctor and the client generate options and bring the two of them together.
Absolutely. I have someone asked, they knew I was going to be, we were going to be talking together, and they said, ask her what the hardest thing is, but I don't know. Is there a hardest thing? It sounds like there's some pretty rewarding things, but.
Oh, yeah. I mean, I've done a lot of different work over the years, and this is by far the most rewarding. When I worked as a physician, I loved helping individuals, but I was frustrated because I was only helping individuals. And so you sort of do the best. In some ways, it almost feels like band-aiding things because the system was broken. And then I went into administration in an attempt to make things better for patients, for families, for doctors. And now I'm sort of back at helping people individually, but at a different level, not just sitting in a room writing prescriptions and churning, but rather now I'm guiding and taking that business knowledge from all that leadership time and that clinical knowledge and navigating these folks for more choices, for better options. I'll never tell them, here's what I think you should do, but I want them to make informed decisions. The thing that's frustrating, probably the most frustrating for me, I've had, well, occasionally, and this is the exception, not the rule, occasionally I've had somebody who wants me to advocate for something that isn't viable, in my opinion. An easy example is during COVID, I had somebody call me up and try to hire me to advocate for ivermectin for their husband when they had COVID. And, I want to present options, but I'm not a hired mouthpiece. And sometimes people hear advocate and they think I'm like a lawyer, that will just argue for you to get you what you want. I want you to make informed decisions. I want you to have choice. But if what you want is not something that is medically manageable or ethically possible, I struggle with that. And I sometimes have to say, I'm sorry, I can't help you.
Yeah. Wow. That's very real, of course. Oh, Gerda, thank you so much. And I will, so again, your website is mymdadvisor.com. And of course, I'll put do you have no, your phone is not on your screen. Say your telephone one more time and we'll say goodbye.
So my cell phone, I'm giving you my cell phone, is 845-316-0175. And my email is gm@mymdadvisor.com.
Gerda, thank you so much. And we'll be back soon. There's some other topics that we want to talk about, but we'll save them and we'll be back. Thanks again.
Thanks, Cheryl.